The Seventh-day Adventist Church is committed to the objective of optimizing the health and well-being of all mankind. Since our inception, we have always promoted holistic health, which includes the spiritual, physical, mental, social, and environmental. That is why we say no to smoking in all its forms and promote the eating of a healthy plant-based diet, adequate water, rest, sunshine, and exercise. God's ideal is for His people to be healthy and happy. Let's do our part in achieving this important objective of living a healthy life.
Hello, pleasant morning. This is day 3 of our 3-day health education seminar. Thanks for joining us. Every man has the opportunity to a great extent of making himself what he chooses to be. The blessings of this life and also of the immortal state are within his reach. He may build up a character of solid worth, gaining new strength at every step. He may advance daily in knowledge and wisdom, conscious of new delights as he progresses, adding virtue to virtue and grace to grace. His faculties will improve by use. The more wisdom he gains, the greater will be his capacity for acquiring. His intelligence, knowledge, and virtue will thus develop into greater strength and more perfect symmetry. Counsels on Health, page 107, paragraph 2. It is with a grateful heart that on behalf of the executive members of the Adventist Health Professional Foundation, I welcome all those who are in the hearing of my voice today, day 3 of our first virtual health education seminar under the theme, Innovative Approaches, Improving Healthcare Delivery and Professional Practice. Take some deep breaths and calm your nerve as we delve into the activities at hand. Proverbs 17 and verse 22 says, "A merry heart doeth good like a medicine, but a broken spirit drieth the bone." Let us pause to invite God's presence in our midst. Kind Father, we pause this morning to say thank you for this privilege you have afforded us, that we can come together in this fashion to magnify your name. We are thanking you for the health you've given. We are thanking you, Lord, for the understanding, wisdom, and knowledge that you're about to impart. We are thanking you for our faculties that are able to understand your sweet love and to motivate us to share this love with our fellow men. As we embark on this program today, I ask of thee to control our mind, our thoughts, our will, and may all activities be done according to your name's honor and glory. For we say thank you for hearing and answering in your blessed namesake. Amen. Please listen meditatively to this song.
Storms of life will blow, they're sure to come and go. They meet me at a time when I'm calm and doing fine. The captain of my soul, he's always on board. He rocks me in his arms while riding through the storm. While riding through the storm, Jesus holds me in his arms. I'm not afraid, no, of the stormy winds, nor the waves, and though the tide it becomes high, Jesus holds me while I ride. I find safety in his arms while riding through the storm. Yeah. I have no fear of the raging seas, knowing Jesus is always there for me. And speak to my winds, and he'll speak to my waves, and he'll make them all behave. All powers in his hands, whether I'm on sea or on dry land. I found safety in his arms while riding through the storm. While riding through the storm, Jesus holds me in his arms. I am not afraid, no, of the stormy winds, nor the waves, and though the tide it becomes high, Jesus holds me while I ride. I find safety in his arms while riding through the storm. While riding through, I'll be riding through the storm. I find safety in his arms while riding through the storm. Yeah. You see, while I ride through my storms, Jesus holds me. Yes, he wrapped me. So I don't need to be afraid. No. I don't need to be fearful. No way, no. Because you know what? I'm protected. Oh, no matter what comes my way, there's no need to fear. He doesn't give us a spirit of fear, no. But a spirit of victory that will overcome any obstacle. Yeah. I will ride with him. You see, when it's stormy, it's okay. I'm gonna be okay anyway. No, yeah. I'm gonna ride with him. Oh, I'm riding through the storm. Yes.
I bring you greetings from the Health Ministry Department of the East Jamaica Conference of Seventh-day Adventists. It is my delight and my pleasure to bring greetings to our Adventist Health Professional Federation, Jamaica chapter, and the marvelous work in which they are doing. We continue to support them, and as we work together to be making sure that health ministries and the health work go forward, we know that great things will be accomplished by this wonderful organization. And so, again, on behalf of my president, Pastor Merrick Walker, and my secretary, Pastor Melvin Francis, and treasurer, Pastor Michael Porteous, and the team at the East Jamaica Conference. Greeting. The East Jamaica Conference continues to have several activities. We are not dormant. And at the moment, we have our mental health training that is taking place, mental health and wellness training, a 4 weeks program, and it is going well. We begin Sunday, the 3rd of May, with our lay medical missionary training also. And there are many folks who are really asking to be registered, and we know that you can be a part of that, and we ask you to come on board and be a part of the army of health workers who will finish the work so that Jesus Christ can come. There are several other activities taking place in the churches, and we continue to encourage our members to live healthy lifestyle, to make changes in their lifestyle. We have the total health program, which is coming up. Last Sunday, we had our medical missionary and consecration service in Zone 4, that is in St. Thomas. And we are looking forward to having other great activities, working alongside with the Health Professional Federation to make sure that this great and wonderful work that God has given to us, the health message, become a reality and become relevant to the life of people. So we implore you, don't put health on the back burner, but put health on the front burner, because we all believe that Jesus Christ is coming, and one day he will require of us of our stewardship. Let us continue to pray for one another and work with one another as we go forward. May God bless you as you venture out in this very special program, and may your dreams and all your plans becomes a reality as we work together. God bless you, and may God continue to lead you. Thank you.
Hello, everyone. Greetings from West Jamaica Conference. What a joy it is to be alive and in our right minds. It's a great privilege to be a part of this very special health program. And not only West Jamaica Conference, but from Jamaica Union. We're so glad to know that the health ministry's work is moving on in West Jamaica Conference. We want to thank the Lord for the many activities that we have embarked upon and have executed. But we have some very important events that are coming up that we just like to highlight, even just a few of them. One of the things that we are preparing for is the launch of Total Health Movement. This will be coming up on June 6th at the auditorium West Jamaica Conference. And it's good to know that many individuals are planning to be a part of that program. We invite you to share with us, even as we launch this great program, Total Health Movement. We're also preparing for a 5K Health Walk that will be taking place in the month of June. There are 4 of them, one for each parish. For June 7, it's going to be St. Elizabeth. June 14, St. James. June 21, Westmoreland. And June 28, Hanover. We are pleased to have individuals preparing for these special events, Health Walk, 5K Health Walk. In St. Elizabeth, we will begin at the St. Levin's Church, Goshen, and will take us right to the St. Levin's Church, Santa Cruz. For St. James, we begin at the conference auditorium, and we will go down Mount Salem Road, down to the clock, continue on to Barnett Street and pass by courts and head into the avenue, which will take us right up to city center. That is going to be Arbor Street up to city center. Then we get down on St. James Street, go right onto Creek Street, then Humber Avenue, and up Cottage Road, right up the hill back to the conference. For Westmoreland, we will start at the Savannah High School, then we take a right turn to Myers Avenue, then we take a right to Chantilly Road. When we reach to the main road coming from Petersfield, then we take a right turn that will take us right to Dunbar River. Then crossing over the bridge, take a left turn onto Hudson Street, all the way down to Russia intersection. At the intersection, we'll turn right, and that will take us to the police checkpoint, onto Rickett Street, to Great George's Street. And up Great George's Street, we take a right turn onto Beckford Street, all the way to Hendon, and then we continue from there right back to the Savannah High School. For Hanover, it's going to be the starting point at the St. Methodist Church, Lucy, right on the Jockey Factory, then back to the St. Methodist Church. And so we're hoping that many individuals will come and join us for these very special 5K Health Walk. There is a registration fee, adult $1,000, and children under 14 will be $500. We're also excited about the fact that the conference has an account at the blood bank. And so individuals are invited to donate blood. Many have been receiving blood over a period of time. And so you can go right to Conner Regional Hospital, the blood bank, and donate blood. Indeed, they are there from 8 a.m. until 4:30 p.m. You can also go to the public hospital, Savannah. They are there from 8:30 a.m. to 4 p.m. and donate blood. The blood you give could very well save your life for tomorrow. Please do the best you can to donate blood. All members of the church, as you are 17 to 65, you can donate blood. And what a blessing it is to know that we can help individuals who are in need. We are pleased for the different programs that are taking place in this conference. One of the things that is doing well is the health clubs. We have a number of health clubs going on in the various parishes, and individuals are being blessed with the very special health programs. We're also having special individuals coming in, even from overseas, where we are having what you refer to as health seminars, and we are expecting even few groups coming in the very near future. In July, in August, we'll be having special groups coming in where we have these health fairs, and many have benefited greatly. Especially in August, we'll be having a number of them where individuals will even receive special things to go back to school. And so join us as we continue to make an impact in this great conference in the area of health. May God bless you all as you continue Do your part and answer the cause. Let us be faithful. When the Master comes again, he can say, well done. We can rejoice with him forever. God bless you abundantly.
Good morning. Our devotional speakers this morning will be Doctors Tamara Henry Gilpin and Tamika Henry. Dr. Tamara Henry Gilpin and Tamika Henry are both medical doctors of health, medical officers of health for the parishes of St. Mary and St. Anne, respectively, where they coordinate and lead the parish public health programs while at the same time coordinating emergency preparedness and offering clinical leadership. As PAHU certified mass casualty management instructors, they possess specialized expertise in disaster response, triage systems, and emergency coordination. They have trained workers in the public sector to include, but not limited to, the Jamaica Fire Brigade, the Jamaica Constabulary Force, the Jamaica Defense Force, and healthcare workers, that is administrative and technical, to appropriately manage large-scale complex accidents with an emphasis on rapid assessment, effective resource allocation, and the implementation of appropriate life-saving interventions. With an acute love for the field of science, both doctors earned their bachelor's degree with double major in chemistry and biochemistry at the University of the West Indies before reading for and completing their Bachelor of Medical Science and Bachelors of Medicine and Bachelor of Surgery at the aforementioned university. Possessing a keen desire to read for a program at an Adventist institution, both sisters took on and completed the Masters of Public Health degree with a focus on epidemiology at the Northern Caribbean University. Continuing to recognize the tremendous need for promotive and preventive healthcare and the symbiotic relationship between the mind and the body, Doctors Henry Gilpin and Henry are both pursuing their doctoral degree in public health, firmly believing that health service is a ministry. The sisters continue to touch minds and bodies, directing clients to pay keen attention to the benefits of good health and the need for an external focus. In addition to this, Dr. Tamara Henry Gilpin and Tamika Henry are committed to mentorship and continue to serve to steer young minds to higher education while focusing on the greatest education one can gain, a knowledge of the great I am. Ladies and gentlemen, boys and girls, all that are on this platform at these seminars, I introduce to you Dr. Tamara Henry Gilpin and Tamika Henry.
Good day, everyone. Today, our devotional topic is consider her ways. And of course, as you can see, we'll be talking about the ant. Did you know that there are over 12,000 species of ants, ranging from those that build underground to those that fly right around us? Did you know that the bullet ant has the most powerful sting in the world? And did you know that the ant is one of the world's strongest creatures in relation to its size? Studies have shown that ant can take things as much as 10 to 50 times their body weight. And of course, you have the Asian weaver ant that can carry things that are over 100 times their body weight. So the Bible says in Proverbs 6, verse 6, "Go to the ant, thou sluggard, consider her ways and be wise." Now, what is it about the ant that the Lord would ask us to consider her ways? Have you ever seen a group of ants at work? I know all of us must have done that. If you try in any way to disturb their flow, you may damage one and maybe a few. And those little ants, they take the wounded soldier, the wounded worker, move them out of the way, get them some help. They're their brother's keeper, and then they go right back to their business. And if you look at the ant, there's no one ant that seems to be the supervisor of the group, but they get so much work done because they work together. And as Seventh-day Adventist professionals, as we gather, just these couple of days to find innovative ways to move ourselves forward by God's grace under the theme, Innovative Approaches, Healthcare Delivery and Professional Practice Seminars, there are several lessons that we can learn from these little creatures. One of those lessons is that together we can accomplish a whole lot. Now, though they're small, together the ants are an army. Each individual ant may be weak, but together they are very strong. And it's the same thing with Christians. We say one can put maybe 2 or 10 to flight, but when we come together and we pray and we lift our hands to God, we can do so much for His cause. The second thing is that teamwork multiplies effectiveness. Now, all of us as professionals, we have different callings. Some of us are nurses, some are physiotherapists, some are doctors. There are so many different groups of individuals, but all of us can do so much for God when we collaborate and come together. And the other thing, as I just said, collaboration, that makes so much of a difference, and it's indispensable for success. The ant teaches us that no matter how knowledgeable we are, our aim is success. And in order to do that, we have to collaborate. No matter how seasoned the ant is, no matter how successful the missions might be on their own, the ant knows that when they are in a team, they can accomplish so much more. As the Bible says in Mark 6, verse 7, "And He called His 12 disciples together and began to send them out 2 by 2, giving them authority to cast out evil spirits." So as you can see, Jesus did not send individuals out alone. He sent them out in groups. Right. And so, like the ant, we need to develop a mindset of unselfish unity. When you find a strategy that you recognize it works for you, it makes you feel less stressed and it gives good returns. When you come up on a solution to a problem that you know that many Seventh-day Adventist professionals are facing, we need to share it. You never know when the one that you share something with will eventually come up on a bakery and will be able to share some of their bread with you. So let us remember that collaboration is indispensable to success. And you know what? Ants are prepared. Prepared, pre means ahead of time. There's no happenstance when it comes to ants. Pre, ahead of time, and peer, they get ready for what is coming. Now let's go through Proverbs 30, verses 24 to 45. It says, 4 things on earth are among the smallest, but they are instinctively wise. The ants are not strong creatures, yet they prepare their food in the summer. And so it is with us as Christians. We have to learn to prepare. And if we want to share anything, get into the habit of not just praying, but studying the Bible, learning what God wants to use us to do and do it. Sister White says that the health message is the entering wedge. And as practitioners, there is so much good that we can do. The ants do not have bachelor's, master's, or doctoral degrees, but they know the indispensable value of planning. Do we? We do not need to be strategic planners to strategically plan for the future in respect of our work, home, or Christian life. I encourage all of us to make no small plans, make big plans for what God would have you do. And at the end of it, make sure that he's at the forefront of it. Because by God's grace, the only undertaking you cannot win at is the one you have not tried at. And as Sister White says in Desire of Ages, page 668, He, God, is well pleased when we make the very highest demands upon him, that we may glorify his name. We may expect large things if we have faith in his promises. Think big things, dream big dreams. And I remember when Lefip said, nothing can stand in the way of a dream that is birthed in the mind of God. So ants are prepared, and ants are also confident. One might say, considering the size of an ant, there's nothing for them to be confident about. The world is so big and they're so small. But however, this would really be a fallacy based on all that we have learned so far. Ants are not intimidated by the size of their workload or the load that comes with the dream that they have. They're a team, and so they work together. They are a team, as we said earlier. And if the grain or the strategy that they have to do is too heavy for one to pull alone, quickly others are going to join in to tackle the challenge with them. So together we can do great things. Another important thing about the ant, even though we talked about team, normally it's one ant that picks up on a scent and they move toward it. They're not just going to sit around and wait for everybody to acquire the vision or the fire. Because sometimes, as Christians, just like the ant, sometimes the dream that God has placed in our bosom is so much larger than other people can even appreciate, and that's what we can appreciate. So sometimes we have to just go forward with God and allow him to bring other persons on board with us. We have to develop what you call Godfidence, knowing that while I can't do it, God certainly can, and he will. If an ant is headed somewhere and you try to stop them, they search for another way out. And we know that. They're going to climb over your foot. They're going to go under something. They're going to go around it. They will always find a way. When we make up our minds to serve the Lord, the truth is that we're going to have distractions. Things are going to come up that, might want to derail you. You're going to have disillusionment. I can't do this. You're going to have discouragement. But nothing can stand in the way of a dream, as I said before, that is birthed in God's mind. And nothing can stand in the way of a dream that is dedicated to Almighty God. There's always a solution to a problem. You may not know what it is just now, but God does. Believe him. Trust him. We give you the secret. And what is that, Sister Henry? Ask him. Asking God, because God is interested in you. As the Bible says in Matthew 7, verse 7, ask and it will be given to you. Seek and you will find. Knock and it will be open to you. As an healthcare professional, do you want to do more for God? Yes. Ask him. Trust him. Seek him. And he will allow you to accomplish what you ask. And then Psalm 37 verse 4 says, delight yourself also in the Lord. Delight yourself in the Lord. Spend time with him. Pray. Have your devotions. Fasting and prayer is so important. And he shall give you the desires of your heart. What are those desires? God will allow them to come to pass as long as they're in accordance with his will and you delight yourself in him. God is able and he's more than available to you. And again, diversions will come, but ants ignore diversions. Yes. We have a bigger calling, a bigger cause, and we have a big God. And diversions may mean difficult, but not impossible. And so again, we say, consider the ant and be wise. Let us pray. Father in heaven, we are so grateful for your blessings. You are awesome, you're mighty, and you're worthy to be praised. We thank you for the lessons on the ant. May we all consider her ways and be wise. May we dream big dreams, and may we trust you for big things in our lives. May we go out and, dear God, tell others about you, recognizing that even as we plan for this earth, we also have to plan for eternity. In Jesus' name we pray. Amen. Amen.
Our topic is Smart Care, integrating technology into healthcare. And our presenter is Dr. Damian Mitchell. Dr. Damian R. Mitchell is an educator with over 20 years of experience and an IT specialist for more than 25 years. Born and raised in Colleyville, Northeast Manchester, he earned a Bachelor's of Science in Information Science with a minor in secondary education from the Northern Caribbean University in 2007. And Master of Science in Computer Science, Software Engineering and Testing from the University of Illinois, Urbana-Champaign, 2011, and a Doctorate of Philosophy in Information Systems, Cybersecurity from Dakota State University in 2022. He currently serves as Associate Provost for Digital Education and Associate Professor and Chair of the Computer and Information Sciences Department at Northern Caribbean University. Dr. Mitchell is also a Justice of the Peace and a recipient of several national and international awards, including the Prime Minister's Youth Award and the Governor General's Award for International Excellence. In 2019, he was appointed Jamaica's country contact representative for China Aid Business with Shandong Foreign Trade Vocational College. He currently serves as an ordained elder of the Waltham Seventh-day Adventist Church in Mandeville. He is married to Siri, and they have 3 children, Zoe, Zane, and Zahara. Please help me welcome Dr. Damian Mitchell.
Welcome to another presentation in this series. And thank you for joining this session on smart care, integrating technology into healthcare practice. Let us begin with a scenario. Imagine with me a patient experiencing early symptoms of heart disease. In a traditional healthcare setting, the patient may go through multiple visits, consultations, tests, referrals, sometimes over weeks. Now imagine a different reality. The patient's wearable device has already been tracking abnormal heart rhythms. An AI-powered system flags the risk, and the healthcare provider receives an alert even before the patient seeks care. That is the power of smart care. Smart care is not just about using technology. It is about transforming how care is delivered. It is about being proactive instead of reactive, connected instead of fragmented, and personalized instead of generalized. You see, in Jamaica and across the Caribbean, we face a double burden. Managing infectious diseases while battling a massive spike in chronic NCDs like diabetes and hypertension, staffing constraints, limited resources. So today, technology is no longer a luxury. It is our most critical tool for resilience. So in today's session, we will explore what smart care means, the technologies driving it, the benefits and risks, and most importantly, how we can implement it effectively in our own healthcare environments. Let us now look at the evolution of healthcare. So, to understand smart care, we must first understand where we're coming from. You see, healthcare has gone through 3 major phases. 1, traditional. That is healthcare where we have paper-based records, limited data sharing, and yes, reactive treatment approach. But then we have the digital healthcare era, where we have electronic health records, digital imaging, and systems and improved efficiency. But now, number 3, we talk about smart healthcare. So this is where we now have data-driven decision-making. So artificial intelligence and predictive analytics and connected devices and systems all play a critical role in smart care. So you may be asking, what has driven this shift? Patients are more informed today and they expect faster, better care. So there's an explosion of health data. We have healthcare systems under pressure due to population growth and chronic diseases, and technology has advanced rapidly. So let us pause for impact and define exactly what is smart care. So smart care is health care supported by digital tools and real-time data to improve patient outcomes and service delivery. So for us in the local context, what this means is that we are moving beyond the paper file to a world where SMS reminders, teleconsultations, and mobile applications become the bridge between the clinic and the home. So the key message here is simple. Healthcare is no longer just a service. It is becoming an intelligent system. So let us pause now to look at some of the core technologies in smart care. So we want to explore the technologies that are making it possible today. At the top of my list is the electronic health records, the EHRs. So EHRs are said to be the foundation of smart care. Why? They allow instant access to patient history, better coordination between healthcare providers, and certainly reductions in medical errors. So for example, a patient is admitted to the emergency room. This patient can have his or her entire medical history accessed within seconds. The power of EHRs. This technology integration, ladies and gentlemen, allows for continuity of care. So according to a recent study, the goal of this integration is really for us to consider the meaningful usability of these systems, ensuring that the data we input today can help us predict a patient's needs tomorrow. Slalom 2026, positive that.
Remember when going to the doctor's office looked like this? Now it looks more like this. Across the country, more and more doctor's offices are using electronic health records, or EHRs. As digital records have become more common, unanticipated problems with design, workflow, training, and how clinicians use them have contributed to patient harm. To learn more, we talked to MedStar Health's Dr. Raj Watwani, a leading researcher on EHR usability and safety.
EHR should make it easier and safer for clinicians to provide care to patients. The suboptimal usability of EHRs can lead to mistakes like selecting the wrong patient, ordering the wrong drug, and missing critical lab results.
MedStar Health's Dr. Terry Fairbanks, who studies human factors in healthcare, explained how a computer auto-refresh error can cause a problem without the doctor even realizing it.
Let's take two patients, Martha Jones and Daniel Rodriguez, who come into the emergency department on the same day and have similar issues, so they both need a chest x-ray. When the doctor goes to see Martha Jones, they pull up the patient's electronic health record to look at the x-ray. And the doctor actually pulls up Daniel Rodriguez's x-ray, thinking that it is Martha's. And this x-ray appears normal, so the doctor sends Martha home. This all happened in a fraction of the second. So let's slow it down to see what actually happened. In between the first and second click, the database updates with new patient information and auto-refreshes. So by the time the doctor finishes the second click, the x-ray icon his cursor was on now belongs to Daniel Rodriguez. Daniel's x-ray looks fine. On the other hand, this is Martha Jones' actual x-ray. You can see there's a large white area here, which represents a pneumonia, which needs antibiotics. Without antibiotics, Martha could get much worse very quickly. This is one example of a health IT facilitated error, and there are many others.
This is a fixable problem, but currently there's not enough research on how and why these errors occur.
All patients deserve the best care possible. We need better data now on how, when, and why these challenges arise so that we can all do a better job protecting our patients.
Now, the second one that I want to focus on is telemedicine and virtual care. Telemedicine allows patients to consult their health providers remotely. And many of you can attest to this fact that this approach grew out of the necessity during the pandemic. Because staying home was the way of the day. And it was harder for these patients to access these services. So things like from mental health counseling to specialist consultations between hospitals and probably rural clinics. We are seeing that with this commuting and telecommunication, we are now breaking geographic barriers. So smart care, therefore, ensures that these sessions will remain confidential, which is vitally important, and clinically appropriate, and yes, secure. So there are some benefits to be derived when we talk about the teleconsultations. Patients will now have increased access to care, reduced travel and waiting time, and certainly continuity of care, even during times of crises. So think about this example. You have a rural patient receiving specialist consultations, and this person lives somewhere in Moko and must travel to, say, Mandeville. The consultant is in Mandeville. With telecommuting, the person no longer needs to leave Moko to come to Mandeville because of the convenience of this smart care approach. I want to now point our attention to artificial intelligence, which is number 3 on my list in terms of the infrastructure and the foundations being used to advance smart care. So if you want me to define, I'm going to go ahead and define what exactly is artificial intelligence. Yes, it's a buzzword out there and everyone seems to be talking about it. But AI is said to be the ability of computer systems to perform tasks that normally require human intelligence. Things such as reasoning and decision making. In other words, in our context, AI refers to technologies that analyze data, recognize patterns, and support clinical decisions to improve patient care. Therefore, today, we see that AI is transforming diagnostics and decision-making in the health sector. So some of the applications would include things like medical imaging analysis, predicting disease risk, and clinical decision support. Additionally, when we talk about artificial intelligence in this context, AI serves as a first line of triage. For example, you have AI-assisted radiology that can now flag a potential fracture or hemorrhage before immediate human review. So this will reduce diagnostics delays by up to 40%, the studies are saying. So in the Caribbean context, we're seeing a proliferation of artificial intelligence where we now have things like AI-powered retinal screening for diabetic patients, which will allow nurses to identify high-risk cases in community clinics without an ophthalmologist. There's another area referred to as ambient scribing. So what AI does now, AI becomes the scribe for the doctor. So while the consultants are speaking, the ambient scribing would be listening and drafting the EHR notes rather, which will now allow the doctors to focus his or her attention to the patient instead of the screen. You know, there are actually reported instances where AI detects early stage cancer from imaging data more accurately in some cases than the traditional methods that are being used. Another area that I want to highlight is that of wearables and remote monitoring. Jamaica, we are told, has a massive mobile phones penetration, where it is intimated that we have a ratio of probably 1 to 2, that is 2 phones to 1 person. Therefore, we can now leverage this tool by using glucose monitoring applications where patients are now able to share things like their blood pressure readings via some secure mobile apps. Because patients are now empowered to manage their own chronic conditions. So this is what I have coined as preventative care in action. So there are many devices out there. You have your smart watches, your glucose monitors, and these provide real-time data. So the benefits to be derived from this are one, continuous monitoring, early detection of issues, and certainly better chronic disease management. For example, you have a diabetic patient monitoring glucose levels continuously instead of periodic testing, and this can be made possible with the appropriate use of these tools available on the mobile platforms. Let's talk about an era that is referred to as Internet of Medical Things. You see, there's something called Internet of Things. So in the world of computer science, the Internet of Things basically says there are many devices connected via sensors. And these devices exchange data. So it could be your garage door shutter, your automatic gate opener, or your microwave, those electronic devices, all equipped with IoT capabilities. But in this context, what we have now is what is referred to as Internet of Medical Things. So what is that exactly? This is a system of interconnected medical devices, sensors, and software that communicate over networks to monitor patients, support clinical decisions, and enhance healthcare outcomes. In other words, these are connected medical devices communicating with each other. So right then and there, you can see that there are so many benefits to be derived. So you're going to have an improved workflow because all the devices are connected and talking to each other. You're going to be able to get real-time alerts and surely enhance patient safety because all the components and devices needed are communicating seamlessly together. The next framework that I want to discuss in the context of smart care is that of data analytics and big data. One thing we know for sure is that healthcare generates massive amounts of data. So when we talk about data analytics and big data, this involves collecting and analyzing vast amounts of patient and health system data to improve things such as diagnoses, treatments, and population health outcomes. Analytics help. How will this help us? As practitioners now, you're better able to quickly identify trends. So it will lead to improved decision making and surely help us to better manage the population's health. So, for example, you have the public health agencies who are analyzing large data sets to detect things like disease outbreaks early and be able to respond more effectively. So together, these technologies are not working in isolation. They are creating what we call an integrated ecosystem of care. Now, you may be wondering, after all the things I've just said, why do we even need to talk about smart care? What are the benefits? So I want us to consider now in this segment of this lecture, the impact of smart care. One, this will lead to improved patient outcomes. Why? Because earlier detection leads to better treatment and recovery. Two, efficiency. Not just efficiency, but increased efficiency. So now we're going to have some of the administrative tasks being automated, thus reducing the burden and the delays. Three, there will now be expanded health. So the telehealth we spoke about earlier will bridge the gaps in underserved communities. Four, we can now use the smart care approach to provide more personalized care. So you can now have treatment plans which are tailored to individual patients seamlessly. And five, this will certainly over time, in the short term and long term, lead to cost reduction because preventative care reduces long-term healthcare costs. And if these can be managed through the smart care infrastructure, then as a spin-off, we can see a reduction in the healthcare costs in our country. I want you to travel with me as we consider a little case. So this is a routine everyday scenario. So imagine there's a working professional who has been experiencing recurring headaches. So in a traditional setting, they would need to take off from work, travel to a clinic, wait to be seen, and possibly return for follow-up visits. Now consider how telemedicine, as one of the examples cited, changes this experience. The patient schedules a virtual consultation during break at work. Within minutes, she's able to be connected to a healthcare provider who reviews her symptoms, accesses her medical history, and provides guidance. If necessary, from this experience, the provider can then recommend tests, prescribe medication, and schedule a follow-up, all without the patient needing to leave their home or workplace. This has several key benefits. One, as I said earlier, it will improve access to care, especially for individuals with busy schedules for limited mobility. Second, it reduces unnecessary clinic visits, thus allowing healthcare facilities to focus on patients who really require in-person attention. Third, it enhances continuity of care, making it easier for patients to follow up and stay engaged in their treatment plans. What we see here is that telemedicine is not just for emergencies. It is a powerful tool for making healthcare more accessible, efficient, and patient-centered in everyday life. So, ladies and gentlemen, smart care is not just about improving healthcare. It is actually about redefining healthcare. So, we must elaborate on some of the challenges, some of the risks associated. While the benefits of smart care are significant, it is important to recognize that challenges still remain. One of the most critical areas of concern is cybersecurity and data privacy. And we have seen many examples now of companies being hit by cyber attacks, ransomware attacks. Just recently, we would have heard about RGR suffering a cyber attack, and many other companies, because daily millions of attacks are taking place. So this is certainly a major concern if we're going to go with these digital tools. Because healthcare systems, they store a vast amount of sensitive information, patient records, medical histories, diagnostic data, and even real-time monitoring information. Therefore, this makes healthcare organizations a prime target for cyber attacks. These threats can take many forms. Data breaches, where confidential patient information is exposed, or according to the Data Protection Act, you may send it to the wrong person, or you may have the file on a laptop that gets stolen. That's a data breach. There are so many things that can happen, and that's a concern. The ransomware attacks, as I alluded to earlier, are attacks where systems are locked until a payment is made and the data is released. So if a company doesn't have proper backups, for example, then that is a concern. We have phishing now, which is where you have the idea of social engineering being used, social engineering attacks being used to ensure that the unsuspected user will give up critical information that can then make them susceptible in the scheme of things. So from what I've said, ladies and gentlemen, you can see that the consequences are serious. A breach does not only disrupt operations, but it can compromise patient safety, delay care, and this is the one that is hard to repair, the erosion of trust between patients and the healthcare providers. Let us elaborate a bit now on privacy. Privacy is equally important. Why? Patients must feel confident that their personal health information is secured, used appropriately, and protected from unauthorized access. You see, without that trust, patients may hesitate to fully engage with digital health systems, which ultimately undermines the effectiveness of smart care. This is why cybersecurity in healthcare is not just an IT issue, it is a patient care issue. Because protecting data means protecting people. We also have a challenge when it comes to the implementation of smart care, and that is what we call resistance to change. And you see it in your work. If they come with a new tool to be installed in the front office or in the medical technology lab office or in the radiology office, sometimes there's a resistance. The whole idea of change management comes into play, and the resistance of users to something that is new and can actually help to make their jobs lighter. Healthcare professionals at times may be unfamiliar with the technology, feel overwhelmed, and as such, they may resist the new workflows. There are also infrastructure limitations. These challenges include things like limited internet connectivity, the high implementation costs for some of these systems, and having integrated systems across the different layers in the health sector. We must be honest with ourselves, though, about the hurdles that we are talking about. We have limited internet access, but thank God for Starlink that came on the scene. We have cybersecurity risks, tech fatigue. These are real concerns. So we also need to worry about the digital divide, because that we should not let technology widen the gap between, say, those who have smartphones versus those who do not. In addition to traditional and operational challenges, smart care also raises important ethical issues that must be carefully addressed. One key concern is biases in artificial intelligence algorithms. So let me come back to this point. AI systems are only as good as the data they are trained on. So if the data is incomplete or unrepresentative, the system may produce biased results. So this can lead to unequal treatment outcomes for different groups of patients, which will then raise serious concerns about fairness and equity in healthcare. Another important issue is patient consent. As technology enables the collection of more detailed and continuous health data through electronic records, wearable devices, and connected systems, patients must be fully informed about a few things. What data is being collected? How is it being used? And who has access to it? That's the Data Protection Act. Consent must be clear, informed, and ongoing, not just a one-time agreement. So sign a form and that's it, and you say, oh, we have the right to do whatever we want to do. But according to the Data Protection Act 2020, the data subjects, in this case our patients, they have a right to access, a right to know, a right to rectification, a right to have their data deleted if they so choose. The rights of the data subject. That is something that we have to bear in mind as we build out these smart care type systems. A third concern is data ownership. Who truly owns the patient data? Is it the patient, the healthcare provider, or the technology company that is managing the system? This is a very complex issue, but what is clear, what is apparent, is that patients should have a few things in the scheme of things: transparency, control, and a voice in how their data is being used. These ethical considerations remind us that while technology can enhance healthcare, it must always be guided by principles of fairness, respect, and accountability. Technology should serve humanity, not the other way around. These challenges remind us that technology must be implemented responsibly. So, while we were talking earlier about cybersecurity, I want us to take a closer look, because it is so important. Because if we're going digital, we know that's a major concern. That's a risk factor already. Healthcare, as I said earlier, is a major target for cyber attacks. And we mentioned some. So for emphasis, I'm going to say it again. The ransomware attacks, the phishing, emails, and insider threats. So what then are some of the best practices as we look at these systems? The management of the hospitals must ensure that the staff members are trained regularly on how to better integrate the technology and how to use the technologies that are being integrated in the scheme of things. We must have systems that allow for strong authentication. So you must have your strong passwords. You must have your multi-factor or your two-factor authentication set up one way or the other to ensure that the security is maintained across all stakeholders. There must be regular security audits. And if we're implementing these systems, we must have a robust backup system in place. So as we talk about healthcare, trust is said to be the foundation of any digital healthcare. Without trust, patients will not engage with the technology. So the old man down country must trust the system. The lady uptown must be able to trust the system. That if they click on the mobile app, it will do what it says it is doing. So how do we implement some of these strategies, or how can we help our managers, if you're not a manager, to implement some of these strategies? Step number one, we have to assess the readiness. Readiness not just of the hospital or the healthcare provider, but readiness of the people, and that's both internally and externally, the processes, and also the technology being used. Step two, it is recommended that if smart care integration is being done, it is best to start small. So you may want to do a pilot project, test the solutions before scaling. This is important. So start at the community health centers before you go to the hospitals. Step three, there must be training that can engage the staff through continuous education. And I mentioned this word earlier, change management. And we know change is never easy. Step four, ensure that there's a strong governance structure. So you have the data protection policies and different compliance frameworks that must be adhered to. Step five, after it is integrated probably in one office, it can then be scaled to another office until it's in the entire organization. So you have to expand gradually as you succeed. I want you to pause for a moment here and ask yourself the question: what is one technology your organization can adopt today? Write it down. And after you have written it down, when you go back to the office, talk to your manager or talk to your supervisor and say, can we integrate this into the lab, integrate this into this office? Ask yourself that question. Now, I want to shift focus and look at the future of smart care. Yes, I mentioned some of the things that are available now, maybe not all in Jamaica right now, but let us look at the future of smart care. You see, the future of smart care is where some researchers are saying we're moving from the hospital to the home. So they're saying the healthcare of the future, especially under the fifth industrial revolution, will be one that is filled with virtual wards. So while we're now seeing an increase in some jurisdictions in terms of the virtual wards, where stable patients are monitored at home via these sensors, and then the clinicians will only intervene if the data shows a deviation from the norm. And the World Health Expo 2026 suggested that this is one of the advances that will take over healthcare in the very near future. Agentic AI and precision medicine. So we have AI agents now that can now synthesize genetic data with lifestyle habits to predict disease risk years in advance, moving us from sick care to health care. So from the agentic approach, we now have what is referred to as localized data sovereignty. So we're from the Caribbean, and we're seeing now that the Caribbean is building this data center, a centralized data system to ensure that our patients' records, they stay protected, relevant, and relevant to our specific population. There are other areas of growth that we're seeing in the healthcare, and these are becoming more predictive and preventative, for example. So you have AI enhancing clinical decisions, personalized medicine. They're projecting that this will grow. And where we're now seeing the human technology, this collaboration that will deepen. Let me just tell you that some persons are scared, some persons are concerned about what AI will do. So some persons are of the opinion that AI will take over some of these jobs, even the healthcare sector. But that is the pessimist's approach. The optimists, like myself, believes that as the fifth industrial revolution opines, that there will be an amalgamation of the machines and the humans are coming together. So this aligns with, as I said, the broader shift towards the fifth industrial revolution, where technology enhances human capabilities rather than replaces them. So let me conclude with 3 key takeaways. 1, from all the things I've shared about smart care and its integration, technology is an enabler, not a replacement. Smart care improves outcomes, efficiency, and access. And surely we cannot miss this point, that successful integration requires strategy, training, and trust. So ladies and gentlemen, I hope this lecture was helpful, because the future of healthcare is not just digital, it is intelligent, it is connected, it is patient-centered. So as we end this session, reflect on this. How can you contribute to building a smarter, more connected healthcare system? What can you suggest? What can you do? You have the ideas. You may not be the implementors, but you can be the initiators of this type of development. So I want to remind you that smart care isn't about having the most expensive gadgets. It's about using the right tools, training our people, and keeping the patient or patients at the center of every circuit and every line of code. Why is that necessary? When technology supports and not overshadows human care, we are able to create a smarter, fairer, and a more resilient health system. Thank you again for listening, and there will be a few questions for you to answer just to demonstrate how much you would have gained from this lecture. Thank you.
We will now break for our educational tips for this morning.
So I'm going to be sharing with you an educational tip. Very, very important. And this educational tip is about hypertension. Hypertension is a major cause of premature death worldwide. An estimated 1.4 billion adults aged 30 to 79 years worldwide had hypertension in 2024. This represents 33% of the population in this age range. An estimated 600 million adults with hypertension, which is 44%, are unaware that they have the condition. Approximately 630 million with hypertension, 44%, are diagnosed and treated. But only 23% of adults with hypertension, approximately 320 million, have it under control. In Jamaica, 1 in 3 Jamaicans have hypertension. That is significant. So what is hypertension? Hypertension is high blood pressure. It is when the pressure in your blood vessels is too high. Based on the AHA and the ACC classification, stage 1 hypertension is when the blood pressure is 130 to 139 over 80 to 89. Stage 2 hypertension is when the blood pressure is more than or equal to 140 over 90. People with high blood pressure may not feel symptoms, and that's why hypertension is called the silent killer. The only way to know is to get your blood pressure checked and to have it checked regularly. The risk factors for high blood pressure include old age, genetics, being overweight, not being physically active, having a high salt diet, and drinking alcohol. It is important to note that lifestyle changes like eating a healthy diet, exercising, maintaining an ideal weight, quitting smoking and quitting drinking alcohol can help prevent and lower blood pressure. So what are you going to be doing today? I want to encourage you to start today by eating more fruits and vegetables. Eat less salt, reduce your intake of processed foods, and eat less animal products. Sit less and be more physically active. You can walk, swim, or ride. Just include more activities into your daily life and also build your strength by lifting weights at times. Lose weight if you're overweight or obese. Get a regular checkup and keep in the know. High blood pressure kills. So protect your health. Get yourself checked today.
Okay, I will now introduce our next presenter for this morning. We have Dr. Paul Smith. He holds a master's degree in counseling psychology from Caribbean Graduate School of Theology and a doctorate in clinical psychology from California Southern University. Dr. Smith is a proud past student at Church Teachers College, where he studied Spanish and history. He's married to Rose. The union has produced 2 children. He is the president of the Jamaican Psychological Society. He has written a book on caregiver burden on family caregivers of parents with schizophrenia in Jamaica. He is the CEO of the Wellness Studio located in Mandeville, Manchester, where he treats youth. Dr. Smith is also passionately involved in education. He is an adjunct lecturer at Church Teachers College and the University Commonwealth Caribbean, UCC. He is a Justice of the Peace, Minister of Religion, Marriage Officer, Clinical Supervisor, Researcher, and Motivational Speaker. His mantra, if I can help somebody as I pass along, then my living shall not be in vain. The topic he presents to us this morning is repairing a toxic healthcare work environment and relationship. Dr. Smith.
Good morning, everyone. And it is indeed a privilege of mine to be on this great initiative. I'm Dr. Smith, and I will be presenting to you on repairing a toxic healthcare work environment and relationships. I just think this is an awesome time to have this discussion, to bring it to the forefront of awareness. Most of us, we tend to spend a lot of time at work. We interact with colleagues, we carry out projects, we interact with patients, and sometimes based on the culture and the atmosphere and the dynamics happening at work, we tend to either respond or react, and it changes sometimes our feature or our communication mode. It determines when we sleep, if it is a stressful work environment. It determines how much we interact with our families and friends. And so work affects us a lot. If work is good, if work is pleasurable, if we look forward to work, it uplifts our mood and we interact well with others. If we can separate work from home, the two will just work excellently. And so we want to look at it. What kind of work environment do you have? Would you describe it as being healthy or toxic? And we want to take a look at that today. So the first thing I want us to probably look at and just get in mind, we talk about definition of terms, and we look at the word repair. And a number of things come to me when I talk about repair. Repair is something that is broken, and we bring restoration to it. Repair is something that is of value to us, and we don't want to lose it. And so we still want to have it around. And so we make effort to repair. Sometimes we might not have the skill sets to repair a particular thing. And so we might need intervention from others. But there are times we have to repair broken relationships. Something happens and the relationship is broken. It is damaged. It is marred. But we have every intention that we will not be comfortable until such relationship is restored and brought back to some order of where it was before. And so when I look at the word repair, even as it relates to the work environment, the professional environment, right? It is the deliberate or willful process of restoring something that has happened. And I want us to note the word willful, the word deliberate. It means that much action must be placed in it. So it is a workplace environment, a healthcare work environment, and a relationship or professional work relationships are broken, then it is upon us who are so concerned. It's about us who are a part of the issue. It's about leadership taking charge to make sure that such relationships are restored. Because if we have broken relationships and negative relationships and dysfunctional atmosphere at work, then it's going to have some negative impact on our output, on our outcome, on patient care, on interpersonal relationships. And I dare say to you that if these things are not managed, they might spill over into family relationships. And so there must be a deliberate or willful attempt at restoring these connections. And I say to people every day that we work with persons and they don't have to be our friends, but we have to have healthy working relationships in order to bring the goals alive. Together we can accomplish, but alone we can do so much and no more. So it is said that teamwork makes the dream work. But if the team is toxic, then the dream also will become toxic. So the second word I want to bring to our attention is the words work, or the phrase work environment, a toxic work environment. And what is this? It's actually an environment where you have negative and dysfunctional atmosphere, where persistent negative behaviors, unhealthy relationships, and poor managed practices create what? Stress. And can you attest to this? Fear. Fear of speaking out. Fear of expressing how you feel. Fear of telling others what bothers you, what offends you. And so those feelings are kept inside and they eat at us, right? And then, of course, we have low morale. So because the environment is so toxic, it is so unhealthy, people do not look forward even to going to work. And so if your work day begins on a Monday, that Monday starts with anxiety, starts with fear, it starts with headache, it starts with what we call psychosomatic symptoms. So the stress becomes a part of the physical, and you have tense muscles and you have aches and pain because work is not where you want to be because it is toxic, right? And so we do not treat patients or clients the way we ought to be treated because we don't feel that motivation to do the best that we can. The best is no longer coming from us because of all the internal factors that are at work. And finally, there is emotional exhaustion for employees. So you're working, but you're emotionally exhausted. You are tired. You lack motivation. You try, but nothing is happening. You're experiencing burnout, right? And this is how serious a toxic work environment can have impact on all of us. So while you're thinking, if you are burnt out, if you are stressed, if you have low morale based on where you're working, you also need to be cognizant of some of the common manifestations of a toxic workplace and by extension, toxic colleagues. And so one of the signs, we have constant criticism or bullying. And so you are at work and you are constantly criticized, and of course this criticism is destructive because it's not helping you. The purpose is more to lower your self-esteem, hit at your self-esteem, allow you to feel a sense that you are not worth it, that you lack value, and you lack the ability to contribute to the growth and development of the company that you're a part of, be it public or be it private, right? And it's also a form of bully. So they wait for you to fall. There's intimidation. You get things outside of your scope of work just with the intention that you will succumb under pressure. They laugh at you when you err. They mock you, they jeer you, And I can tell you that bullying just doesn't happen at school. It's very much alive in some work environment, especially for someone who might be new to the organization and there are others who are senior, quote unquote. And so the attempt is just to shame you. It's to bring some low morale. It's for you to probably just quit even before you begin. And that is a sign of a toxic work environment. As a matter of fact, it becomes a culture after a while. So every workplace has a culture. And some workplace cultures are toxic, and some are indeed healthy, and there are others that are improving. But another sign of the toxic work environment, toxic people, are those who gossip. So their persons will bring others to the boss, or to the manager, or to the director, or they gossip among themselves. They talk negatively, they whisper, and while they're doing that, they're looking at you. You know that they're talking about you, yeah? And you feel so uncomfortable. And then thereafter, they might give you a smile, a fake smile. They fake it. But you know deep down within that they are not with you at all, you know, and even your personal life is brought to work, and people will gossip and talk negative thing about you. And I don't know about you, but gossip is just a venom. It's just unhealthy, whether it is at work or at home, wherever it is. And there are persons who like to run with gossip. And when they gossip, they make it juicier as they pass it along. But the whole intent and purpose is to bring you down, is to damage you emotionally and make you feel as if, boy, that place is not for you. And it is for you because you have your place there, you have your gift, and you have your talent. And so there's a need to belong, but there are others, unfortunately, who do not feel the way that you do. And there's favoritism. Favoritism from probably the manager in how he or she treats workers. There's no issue with giving time off or day off or a mental health break. There's always favoritism as to who gets the chance to present a project, yeah, who gets public recognition in a meeting. Yeah, there's favoritism among even middle leaders in the organization, how they treat employees, yeah, supervisors, and sometimes realize that the more power people have, the more some of them can manipulate it and show favoritism. But this ought not to be a part of the culture or the modus operandi of any organization. Everybody deserves to be treated with equity and equality. Everybody should be seen as important. Yeah? And some persons are the feet, some are the head. But guess what? We are all interconnected, and you can't do without the others. Unfortunately, we also have cliques. There are cliques at work. There are cliques in the workplace, and they gang up and they walk together and they talk together and they intimidate others. Yeah? And if you're not a part of the clique, then you are the odd man out. Yeah? And sometimes these cliques have some values that you do not ascribe to. So you can't be a part of it. And so if you're not a part of them, then you are against them. And this becomes emotionally pressuring as well. This can become overwhelming, right? And so we have these at the workplace. And then we have lack of support or respect. So support is not given if you're a particular person. Support is not given to your department. Support is not given to your unit. You are expected to carry out work, but then you do not have the necessary resources to carry out such work. You often write reports and make your complaints known, make your queries, and they seem to be ignored. And then at the end of the month, when you're supposed to report on your area, you can't do much because you have been restrained and constrained through the entire month. Yeah? And this can be intimidating as well. Not that the organization lacks the support or the resources, but then it's you, unfortunately, right? It's your colleagues, unfortunately. It's your team members. And then we have lack of respect. Respect begets respect. How do we talk to each other? Yeah? How do we talk to the person who cleans the floor? That job is extremely important. And you know what, ladies and gentlemen? I admire persons who take care of our environment. And so when you get up early in the morning and you see the men on the truck and they are exposing themselves to all kind of things. Some are not using protective gear and all that kind of thing. But I often stop and I look at them and I say, look at how many of us look down at them because what they're doing is demeaning to us. We would not do that. But they deserve respect, and I call them environmental technicians. They are taking care of the environment. So when we go to work, our environment is clean, it is welcoming, it is just refreshing, right? And that allows psychologically us to kind of set the tone for the rest of the day. So we ought to show respect, whether the person is up there or down there. Colleague, co-workers, managers, it doesn't matter our position because all we have at the end of the day is just position and we're not irreplaceable. Yeah? And so how we treat people should be an indicator of the legacy that will be left behind even after we leave the workspace. It is important to just respect people, our mannerism, our way of encouraging others, our way of talking to each other, our tone, our body languages. It's just important that respect is a hallmark within our workspace. And then we have unrealistic workloads and by extension, expectation. Yeah? And some persons carry heavier workloads than others. And again, this is a recipe for stress, for burnout, for depression, for anxiety. Because it is just too much and your desk is never cleared. There's always more being added to it. And it's not because there is a necessity really, but because that pressure falls on you. And sometimes there are those of us who are doing even the work of 3 persons. And so it becomes overwhelming at times. Then another thing is micromanagement. And sometimes we have some supervisors, some leaders, some managers who micromanage. And so they are involved in everything that is done, that you do. There's no growth for development. There's no chance for development and growth. Yeah. Instead of their manning, then do the administrative aspect of what they are employed to do. They actually now are telling you every day, every minute how your thing is done and it's done properly. And they are there at your class, they're there at your workplace, in your room, and you're constantly under survey. So from this we know that management leadership can, based on their styles, based on their modus operandi, that they can allow the workplace to be toxic. And so there are some managers, some leaders who are not, people do not find it a pleasure to work with them because they add to the level of stress, and they add their stress to your stress as well. And their leadership style is just not inspiring. It's just not motivating at all, right? And so leadership also has to be a part of this conversation in cleaning up, in repairing a toxic work environment. And then we have high stress and burnout. So all that we have said before, result in employees feeling a high level of stress. Yeah. Burnout. You're emotionally tired. You're out of ideas. You can't, you have ideas, but you're not able to implement them because you're burnout. You're not resting. You're not sleeping. Your diet becomes out of sync because the nervous system now, starts to respond to all that you're going through at work. You cry so many times as an outward manifestation. Some persons pray and ask God, when will this end? Or ask God, when is the right time for me to leave? I want a better work environment. So it affects the entire man, it affects his psyche, right? And there's discrimination or harassment. So based on who you are, based on how you might dress to work, and some persons believe that, hey, you're from a different class, you're not in their category, right? The position you hold is just not up to standard with theirs, and the way you appear, and they openly criticize you, they openly just avoid you. They avoid, your decision making skills, your contributions are ignored, and there's harassment. There's harassment in a toxic work environment, a toxic healthcare work environment, and the harassment can come from up top, it can come from in the middle, it can come from those who work below you. This constant harassment as if you do not belong. And then you have employees who feel a high sense of fear to want to speak up. And that's a subculture that we have, even among us as a nation. We associate speaking up with punishment, with intimidation, yeah? And I don't want to lose my job. I don't want my salary to be cut. I don't want this to happen. And you have something that bothers you. And you want to speak up. You want to say something. And you have it bottled up inside of you. And this is, you're killing yourself off emotionally. And after a while, you're so immune to it that it's as if you're taking poison. And you're hoping that after swallowing the poison, it will not hurt you. That is how toxic a workplace environment can become. That is how toxic when you do not have the opportunity to speak the way you want to speak. And so we have to bring self-awareness today. And the question I ask you, I have mentioned a number of signs of a toxic workplace and toxic people. Can you identify? Are you toxic? Do others think that you are toxic? That is self-awareness as well. All right? So then we take a deep breath, and I'm taking a deep breath myself because I can tell you I have been there. I have been in an organization that was just toxic from the head straight down. Yeah? And yes, it was hard to deal with. You just had to give yourself some self-talk every day and talk yourself into going to work and talk yourself into giving your best, right? But we have some impact that I want us to tick off, to see if it's a part of our work diet as well, and anxiety. So the work environment, if it is toxic, can bring anxiety or depression. Anxiety is deep worry. Yeah. I'm worried now about what might happen at work tomorrow because today was not good. The fact that work is not good, I am anxious about it. So I am not sleeping. I am not resting. I am not in a relaxed position most of the time, even after work. Right? And when you talk to your children or your spouse and They ask you how was your day. You just want to talk about it even for an hour or two, right? You have sleep disturbance because subconsciously, even consciously, right? The happenings at work, they just are a part of your daily thoughts, right? Depression is common. It's a mental diagnosis, and there are persons who go to work and as a result of the toxic work environment are suffering from depression. Depression and anxiety are mood disorders. They affect your mood. Depression in particular affects your mood. Yeah? It makes you sad. There are levels of depression. You have the low and you have the what we call probably medium and the severe. Yeah? And people go to work and they're on depression. Some will have to go on antidepressant medication just to stay calm, just to have the nervous system calm because work has gotten to them. It is said that sometimes it is how you respond, but it is beyond your response sometimes. It is just what runs through the vein of that organization. And then we have low motivation. Are you motivated to go to work? Are you motivated to show up? Are you motivated to be creative? Do you think you bring something creative to your desk, to your department, to your unit? It's the same old, because you don't believe that if you bring any changes, it will be recognized. You don't feel that way. You're asking yourself, to what end do I need to bring any changes? To what end do I need to be creative? Yeah. To what end do I need to speak out and think outside of the box? Right. And you have poor job satisfaction. You're just not satisfied. Of course, you're being paid, but there are times that money is just not the end all to it. If you're not looking forward to going to the job, if you realize that you have poor morale and so you are underperforming, that's not you at all. Possibly you just joined the organization and it wasn't toxic then, you would have been excited about bringing an idea to your team members, bring an idea as to how patients and clients can be happier, have a suggestion box and they can look at it, have evaluations quarterly and so on. Have customer service person of the week, employee of the week, those kind of thinking outside of the box. But then, boy, it's just a drag on your mind, on your system. And you wish every day you just get a day off. You wish you just get a long vacation because you just don't want to be there. That's toxic. That's toxic to your emotion and your mind. Yeah, it's poisonous. Yeah. And then you have physical exhaustion because you overwork. There's so much to do. You're physically exhausted. So can you imagine the physical exhaustion and mixed with the anxiety and mixed with the depression and mixed with the low motivation and poor job satisfaction? I think you're physically exhausted. Man, that is a lot, I can tell you, to go through. And then you talk about increased conflict. So with an environment that is so toxic, it is prone to conflicts every day, passively and actively. Conflict, inner conflict, external conflict, and everybody's walking over each other. There's a high level of competition, and I am better than you are, and everything starts to happen and to come at you fast and furious. So conflict among co-workers, chaos, confusion, things are just happening. Nobody seems to be in charge. Yeah? And you're hurting, and I say hurting people hurt others as well, and we can hurt each other within the work environment. And then we have low productivity, poor patient care. So patients, they complain. They say, what is happening? The service is just moving at a snail's pace. Yeah? We can know that that person doesn't talk to that one because there's a breakdown in communication. And when she'll be discussing a patient, turning over to another person, that is not there. So there's a gap, and somebody repeats what somebody else has already done. And it affects the patients mentally and emotionally and psychologically, that they sit and they wait. But that kind of energy is passed on to them as well. We normally smile and say, "How are you doing?" We no longer do that because so many things are competing, right? A healthy healthcare work environment. What is a healthy one? So if we have the toxic, we must have the alternative. We must have the ideal. We must have the marker, right? And a healthy workplace environment, it promotes respect. Respect is foundational. Respect for the clients, respect for co-workers, respect for management, and respect is reciprocal. So respect does not have to do with the position that you hold, the chair that you sit around. It is just human dignity that we show respect to all, right? And then because the environment is healthy, teamwork is just seamless. We get things done easily. We get things done in an orderly way. We get things done and we're happy we are working in teams, and the team is producing, the team is meeting targets, the team is just working towards the benefits of the organization. And I tell you, when teams work, when employees work, I tell you, leaders look good. Even when leaders are not doing anything, they look good because the team is dynamic, the team is working. And then the issue of fairness. Again, in a healthy work environment, there's equity and there's equality. It doesn't even matter if I have a disability. It's not about my disability, it's about my dignity and my worth and my gifts and my talent and my zeal and my passion to get things done and to be the best employee that I can be. Also, there must be open communication. Communication can make or break relationships. It can make or break an organization. And so open communication, people are allowed to share their views in a meeting without being bullied. Yeah, persons can believe that I am free to say that I disagree with my coworker. And we can always agree to disagree. It's just the dynamic of life. But there are some persons, if you disagree with them, it means that you're against them. You're bad mind. Yeah? But a healthy work environment will promote open communication. Open communication between employees and managers or leaders depend on the makeup of our organization. But I am very quite passionate about employee well-being, because a part of the healthy work environment is the issue of well-being. How am I doing emotionally, mentally? Are there programs in plan? Are there programs now operating for me to just go and sit in a peace area and can let it out and can ventilate and can bring back things into harmony? Yeah? Is getting a mental health break, a part of the culture, the healthy work culture. When I feel stressed out, do I have the liberty to take a 5 minutes walk downstairs? Yeah, and just talk to my co-worker, and I just get up from my desk and I stretch and relax my muscles, or I go downstairs to make a cup of tea that kind of thing, and you get back to it and you're not working in a straitjacket organization that you're constantly watched and monitored and questioned and scrutinized. No, this doesn't happen in the healthy work environment. And then you have optimal patient customer care. Patient customer care, you want to make sure that, hey, because my work environment is stimulating, mentally, emotionally, intellectually, I end up taking care, the best care I can of my patients, a nice smile, a nice hug, a nice how are you, how is the family. It's so good to have you today. These things are important, and we do it to each other as colleagues as well. We ask questions from a point of empathy. These things are important. So question, are you a part of a healthy healthcare work environment? So the big question in the room now, ladies and gentlemen, if my workplace environment is toxic, there is an urgent need to repair. Yeah? When we repair that, it means that relationships can be restored. My morale can go up. I am doing better emotionally, psychologically, even physically, even financially. I am doing so much because guess what? I mentioned financially, because if we are constantly sick, if we are constantly having depression and aches and pain over the body, then I can tell you we are going to go elsewhere for treatment. And ever so often we have to pay, and sometimes it's cost our pockets because healthcare is very, very expensive, right? And so we have to promote open communication, which is the first one. Team meetings, have regular team meetings. Check on the team, how are things going? How can we help to make things better? What are your ideas? How can we facilitate your ideas? Yeah? Then we have sessions, counseling sessions, right? And a number of companies have what we call the EAP, the Employee Assistance Program, where the employees are allowed to go to counseling sessions, and HR or the company will pay for those sessions. So it doesn't come from the employee's pocket. Yeah? And so that has to be a part of the culture as well. Because, if you are healthy, mentally and otherwise, trust me, you will get things going. You'll see what you're doing as not as a job, but you just look forward as you're making a contribution to society by what you do. Then we have open door policies. There are some leaders whose doors are closed, and only the selected few can go into the office, and you're called to make an appointment to see the manager, the director, and the person is always busy, or I'll call you back, or I'll get back to you. But an open door policy means that you can come inside and we can sit and we can talk and I can listen to you. Anonymous reporting. If something is not going well, I can make a report, whether it is a justification box, and I put what is bothering me, and they are addressed, of course, right? So we rebuild trust through consistency. Whatever changes we make, the changes must be consistent. If we are moving from a toxic environment to a non-toxic environment, and we make changes, changes must be consistent. We can't start today and then tomorrow we drop off and then we are going like something that, what we call it, a roller coaster. There must be consistency, and it must be perceived, it must be felt, it must be communicated to all stakeholders. Transparency. Things are done and you're seeing what is being done. You're a part of what is being done. Accountability. is also very important. People must be accountable to each other. Managers must be accountable to employees, accountable employees to managers, and it's just vertical and horizontal, and it's good. Sticking to commitments is important. Yeah. And so if we are going to be a part of the change, and I tell you that we have to be a part of the change that we want to see, we have to be mobilizers. Yeah. And so if my team decides that, boy, in order to rebuild trust and accountability and consistency, then we are committed to it, right? So there's commitment all across the board. All hands are on deck to rebuild our workplace, to rebuild broken relationships. Respectful interaction. We interact with each other, and of course we do it from a point of respect. How we say it, how we conduct ourselves, how genuine we are in what we do. And then we're saying that leaders ought to model the behavior that they want to see in their employees. So leaders must be exemplary. Leaders must be persons who communicate. Leaders must be persons who know how to relax and have fun. Yeah? Leaders can leave their desk one day and just visit an employee's office and just sit and chat and talk and laugh and lighten the atmosphere. That becomes important. It is important as well that as we repair a toxic work environment, that we address conflict early. Well, how do we do this? We have active listening. And active listening is a skill that we need to have. Somebody comes to us in an issue, our posture becomes important, how we sit. Our eye contact is important. Our body gesture is important. Body language is important. Manager can sit and exemplify what active listening is about when an employee has a complaint, with a patient has a complaint, a customer has a complaint. There's this need of active listening, right? Problem-solving discussions, or something has happened in the organization. Everybody's called together, no matter what you do there. And we have an issue, we have a challenge. How do we together fix it? Yeah? Problem-solving discussions. And then we need to have emotional intelligence skills, self-awareness. We ought to be self-aware of who we are. Self-aware as to what our purpose is. Our purpose is within the organization. What's my value? Am I suffering from low self-esteem, where I can't seem to be a part of what is happening? Sometimes we have to check ourselves as well. Emotional regulation. What triggers me? Why have I been so angry for the past 2 months? Why have I become so antisocial, anti-team? What's happening to me? Why do I feel so depressed? Self-awareness skills. What makes me happy? What environment makes me happy and productive? Right? We have more, we have self-regulation. We are responsible to regulate our emotions. So whatever bad happens at work, I make sure that I regulate my emotion so my family does not get the wrath or the offspin from work. They are not responsible for how I feel. Or I might leave from home rather, with an unresolved issue. And there it is, I go to work with it. And so I contribute to the toxicity in that workplace as well. Motivation is a part of emotional intelligence. Your willingness to get things done. Are you intrinsically motivated or you're extrinsically motivated? Do you have a high motivational index? Are you a high performer? Is that you will not settle for mediocrity, for little or less? Yeah, you have good and measurable standards, good and measurable goals. Those are important. Check it now, man, and see what's happening to you now. Mutual respect has to be a part of the ingredient as well. Has got to be a part of the repairing process. And I can't overemphasize how respect is. No matter how small a person is, respect is due. No matter your position, respect is due. No matter how you feel, respect is due. And then we want leadership to have this transformational style with them. So if a leader sees that the workplace is toxic, the leadership ought to be transformational in getting things back on track, not by himself, but using the entire team to do it. Motivational, transformational. He or she makes things happen in the interests of the employees and the workplace at large. Staff support well-being is important, right? Mental health resources, as I said before, counseling services, stress management programs, exercise program, a particular evening, after work. Yeah, you work together. Wellness initiatives, right? Burnout prevention strategies. All these are important going forward. You see, so creating a healthy workplace culture. And I said every workplace has a culture. You go to some banks and you see the culture just as going to the culture. You go to some business places and you can see the culture that which runs, that is the culture is operated by, a company that goes all the way out to make sure that employees are okay, employees are satisfied. You go on excursions, all-inclusive hotels, those kind of things, a reward system, recognition for work done, right? Respect, compassion, and of course, accountability. Yeah, quite a mouthful. Quite a lot to think about. And as I talk to you, I'm even thinking about it. I'm a leader myself. And I have to check myself constantly. What kind of leader am I? And as I close, there's sometimes that we are co-workers, we are employees, and we treat people badly. And we treat people sometimes because of the position of authority that we hold. And I say to people all the time, their persons might forget what you say. They might forget what they hear. But they will never forget how you make them feel. Yeah, that goes a far way. So we're saying that, therefore, repairing a toxic healthcare environment requires commitment, leadership, empathy, teamwork. Healthy workers are also able to improve employee well-being and strengthen collaboration and enhance patient care. And I just have to say this one, that whoever you are, listen to me, watching this presentation, you have to self-care. You have that responsibility to self-care. Take care of yourself. Connect with others. Think positively. Inhale. Exhale. Play. Dance. Sing if you can sing. Pray. Have a close connection with God. Have a good support system. Meditate. All these things are important. Laugh at yourself. Learn to laugh and smile. It takes nothing. It costs you nothing to smile or to laugh. Forgive somebody who have done you wrong, whether it's at the workplace or a boss. Just forgive. Because when you do not forgive, unforgiveness holds you as the captive. It holds you as a prisoner. It affects you in every aspect. Free yourself from hurt. Free yourself from disappointment and betrayal. And realize your full potential. Have that eagle mentality that you are going to soar above your challenges and your circumstances. I thank you so much for listening to me, and I wish for you a healthy healthcare work environment. Repair broken relationships. So important to do it. Blessings, everybody. Thank you so much.
Okay, so this has taken us to the end of our morning session. I hope that we will be willing to apply the knowledge that we've received, and it will be beneficial as we go throughout our daily activities. Kindly click on the link and complete the questionnaire so the CMEs can be awarded. Remember to join us in the afternoon for after evening session. It promises to be interesting. Have a profitable day.
The Seventh-day Adventist Church is committed to the objective of optimizing the health and well-being of all mankind. Since our inception, we have always promoted holistic health, which includes the spiritual, physical, mental, social, and environmental. That is why we say no to smoking in all its forms and promote the eating of a healthy plant-based diet, adequate water, rest, sunshine, and exercise. God's ideal is for His people to be healthy and happy. Let's do our part in achieving this important objective of living a healthy life.